There's several different technologies that we have that tighten skin. Some of them are more invasive, some of them are less invasive. Some of them would include thermal energy, some of them would include radio frequency. For the face, we see, kind of the lower face jowling, submental areas, skin, neck laxity, that's very common. On the body, we're seeing abdominal laxity. Sometimes we're seeing, the bat wings, the back of the arms, inner outer thighs are common as well. The technology over the past several years has really changed the industry. Before, you really required a more invasive procedure to get that, at least 50% tightening. We do have several devices now. We have the InMode Evoke and the InMode Evolve, which are wonderful at skin tightening. They also can do some fat remodeling depending on the temperatures. And we're able to tighten the tissue. It's non-invasive. It's essentially painless procedures. So everyone, their goal is a little bit different. Some patients it's mild laxity, other patients it's extreme laxity. Depending on their desired result would depend on if we want a more invasive approach like the InMode Body Tight or Face Tight, or if we're looking for something that may be a little more non-invasive, may take a little longer to see a result like the InMode Evoke or Evolve. Unless we decide to do a more invasive treatment. So the more invasive treatment, InMode Face Tight, Body Tight, would likely be a one and done. Occasionally, some patients we may require 2 treatments, but most of our patients that have more extreme laxity, we're either looking at a non-invasive approach and several different treatments, or we're looking at a minimally invasive approach like the Morpheus 8, where we're maybe starting with a series of 3. Really, the biggest worry in terms of skin tightening would be you could burn from the machine. You could also have some fat remodeling that you didn't want present. You just wanted the skin tightened, but you didn't want any of the fat removed. Most patients, their biggest concern is that the skin won't be tightened enough, that they'll spend a lot of money on a procedure and they'll receive a mediocre at best result. Here at Plaza Aesthetics and Wellness, we make sure that we always discuss patients' goals and that we have an appropriate understanding of what's average for our patient population and what they can expect. That may also guide what treatment is appropriate for the patient. One thing that I have seen more recently is we will have patients that have maybe gone elsewhere. They saw an immediate result and then they didn't keep up with the treatments. That could be on the patient's part, or it may have been that they just went in, they received a procedure, they left. There were really little to no discharge instructions and there were no follow-up instructions. The technology is always changing, so it may have been a procedure and it's just been time and they need another procedure. But I would say that we do get several patients that maybe had inadequate expectations or inadequate instructions and are seeking maybe another treatment, where if they would have kept up with smaller treatments after their larger treatment several years ago, maybe they wouldn't be coming in to see us for another treatment.